And then I can hold them, and then you can't.
Thank you.
Can you bring walk this way?
My name is Takayla Clay. I'm a student at MUW, currently enrolled in the BSN program for the advanced placement option. This evening I will be talking to you guys on antibiotic usage, antibiotic stewardship, and with this presentation we will cover the benefits, the risks, the true reasons for using antibiotics, and when not to use antibiotics. By the end of this presentation, 4 of the audience members will correctly be able to identify 2 incorrect ways of using antibiotics. 2 of you guys will be able to correctly identify what antibiotics actually treat, and 3 will be able to correctly verbalize the importance of completing all antibiotics prescribed. Antibiotics, they're also called antibacterials. They're used to treat and prevent bacterial infections. They also kill or inhibit the growth of bacteria. When we say inhibit, it kind of stagnates it or basically prevents it from actually growing. Antibiotics are used to treat infections. There are different types of infections. You have viral infections and you have bacterial infections. The second point covers what antibiotics do not work to cure, which are viruses or fungi, which we will later cover in the presentation. The use of antibiotics can also cause resistance with each dose that is taken, and we will also cover that in more depth later in the presentation. When using antibiotics, do not take the medication other than your own. I will repeat that. Do not take the medication if it's not yours. Do not take anyone's medication other than your own. Second point is also very important. Do not stop taking the antibiotic once you feel better. Whether that's after the first dose or the second dose, whatever dose it is, complete your medication. And that's the third thing. Complete the entire amount that is prescribed. So if you're given 30 pills, take all 30. Don't take 10 and say, I feel better. The infection is gone, so I'm going to wait till the next time to take some more. Once I start feeling bad, then I'm going to take the rest of them. Complete it at that given time. The risk and the benefits. The first point, it just basically goes over what we just discussed not too long ago. It kills or inhibits the antibiotic. That's an actual benefit. It prevents a bacterial infection. That's another benefit. It does make you feel a whole lot better, but the bigger benefit and the bigger picture is to complete the entire prescribed amount. That'll have you feeling better. Rather than feeling better just a few days, you'll feel better longer and longer. Now we'll get to some of the risks. With each dose that is taken, you actually are starting to develop a resistance to the antibiotic over a period of time. It increases the chance of you creating a superbug, and a superbug is basically you become resistant to the antibiotic. So with each antibiotic you are given, you take the risk of the antibiotic not actually working depending on what type of infection you have. It also places you at risk for C. diff, and this is a very infectious disease that comes along through diarrhea. It can give you diarrhea, and basically it can cause C. diff. And the medication is likely to be less effective. So once you create a superbug, after you stop taking your antibiotics like you should, each antibiotic that the doctor tries on you becomes less effective, and that can lead to possible death because you will not have any antibiotics that will be able to be used on the different type of infections that you may have. Here are some examples of antibiotics. I'm pretty sure you guys probably have heard of all of this because some of y'all have probably been prescribed some of these. Amoxicillin is normally given when you have like a tooth infection or the doctor is looking to pull some teeth, or you have had a tooth pulled. Levaquin, it is used with pneumonia, and pneumonia is basically an infectious disease of the lungs, bacteria in the lungs. Macrobid is most likely used with urinary tract infections, and some people call them kidney infections, and that's basically the bacteria in your urinary lines. And azithromycin, that's normally commonly given with upper respiratory infections, mostly what we call sinus infections. When not to take antibiotics. Again, when the medication is not your own. If you are not prescribed the medication, please do not take it. We tend to have friends that say, oh, you say you're feeling bad, you think you got a sinus infection, I got some antibiotics at the house, you can have mine. Do not take the antibiotics when some are left from your prior doctor visit. If the doctor did not prescribe them for your current sickness, do not take the antibiotics because you may have a different form of bacteria growing. So that particular antibiotic may not inhibit or actually kill the bacteria that you have currently. Basically, we just covered the third point with me discussing the second point. When the current medication prescribed is not for the current sickness. Again, because the bacteria type may be different. When you have a virus or a fungus origin of infection. And a fungus can be something similar to like a yeast infection. And we will get more in depth with that because some antibiotics actually do bring on different types of infections, like a yeast infection or something of that sort. For my summary, overall antibiotics should be taken correctly as ordered by only the person in which the medication is prescribed to. So basically only take your medication because you went to the doctor actually knows what particular bacteria you have, so he knows what particular medication to prescribe to you. The medication should be completed to reduce the risk of resistance and the formation of superbugs. And one form of a superbug is called MRSA. And that's when you have antibiotics that are very resistant to this particular infection. Okay, now we will go to our actual handout. And this is basically just giving you some educations on when and when not to use antibiotics. Okay, this basically just goes over more in depth what we just talked about. Bacteria infections that antibiotics can help include strep throat, pneumonia, bladder infection, and gonorrhea and chlamydia. And gonorrhea and chlamydia are most likely to be transmitted through sexual intercourse. Those are the things that antibiotics can be used to treat. Antibiotics do not help things of the sort such as viral infections, which can include the common cold, the flu, a sore throat, it's acute bronchitis, and sinusitis. But we did say that it does help with the upper respiratory infections. That's what azithromycin can help to cure. Antibiotics do have side effects though. It can have the side effect of diarrhea, like we said, that can cause the C. diff. You can have nausea and you can have vomiting. That's why most doctors say take with the snack or take with the meal when you're taking antibiotics, because normally